This segment of DelmarvaLife is sponsored by TidalHealth Home Care.
Something you may not know as you navigate your health, some patients who need IV antibiotics are able to continue their treatment at home instead of staying in the hospital.
TidalHealth Home Care makes it possible. Jessica Lewis is a registered nurse, and she's also a wound care specialist with TidalHealth Home Care. Welcome.
Thank you. Thank you for having me.
So let's start with, why is it beneficial for patients to finish their IV treatments at home as opposed to being an inpatient?
When the patients are at home, they're less stressed. They're able to rest. They're able to sleep in their own bed, which ultimately allows them to heal quicker, get back into their routine of things. So it benefits them.
Okay, so some patients, I know I would be a little worried about having an IV at home, but TidalHealth Home Care actually supports the patient doing
Absolutely.
that? How?
So our nurses are trained to teach the patient and the caregiver what to monitor for, such as line issues, antibiotic reactions, side effects. They also teach them how to manage and infuse it. We have a 24/7 nurse available if they have any questions, even if they call at 2:30 in the morning, we're there to support them.
So what about the risk of infection at home as opposed to in the hospital?
So while they're at home, they're in their own environment. At the hospital or inpatient, you do have a higher risk of having a infection from the hospital. At home, we teach them how to keep things clean, how to make sure they wash their hands, use their gloves, and they're in their own surrounding.
And I imagine there are benefits emotionally and psychologically whenever you're at home getting this treatment as opposed to being in the hospital.
Oh, absolutely. At home, while it can bring some anxiety, we're always there to support them. So being at home, their stress levels are a little bit lower after that initial teaching, and they have the support of us all of the time.
It's wonderful.
So how can folks who need your IV therapy, how can they get in touch and how can they get involved in the program?
If they're at home, they would obviously have to reach out to their provider, their primary care provider. But if they're in the hospital, they can work with the case management team as well as our in-house liaisons we have at both facilities to help facilitate that home care.
And they're not going to let you go home without educating you on what you're doing, is that correct?
Well, they do educate you, but that's where we come in and provide the hands-on education and support while they're at home.
A lot of good peace of mind right there. Jessica Lewis with TidalHealth Home Care, thank you so much for coming in and talking
Thank you
with
for
us
having
today.
me.